Cholera outbreak in Ghana has hit a record high of 17,000 cases with 150 deaths. Now, the last time Ghana suffered such a staggering number of cholera cases was in 1982. Signs of cholera outbreak were on the wall after heavy rains consistently exposed most markets in Accra as filthy. Foul smell of rubbish assails the air as it sat by roadsides and remained uncollected for days. Health officials warned that the disease caused by poor sanitary conditions and lack of good hygienic practices could break out. In July this year, the prediction indeed became real, with cases first reported in Accra. Most of the cases are from the La community, some from the Osu Teshi, and since then the rise has been unrelenting, with health facilities overburdened. The Greater Accra Regional Health Directorate of the Ghana Health Service in August officially declared the outbreak ravaging parts of an epidemic. And all regions in Ghana except the northern region have recorded at least a case of cholera. Ghana has so far been saved from a more deadly pandemic, Ebola, which has killed over 3,000 people in West Africa. As far as the country is concerned, Ghana, Ebola, our own form of Ebola perhaps is cholera, but it's also worthy of note that indeed the situation in Accra is getting better. The situation in Accra is declining gradually. Unfortunately, in other regions like the Eastern and Volta regions, we still record increasing number of cases and deaths. But you recall also that government had said it will come in with some vaccines to deal with the situation here in Accra. Dr. Baduose is with the University of Energy and Natural Resources. He's joined me over the telephone. Doc, you're welcome to the program.
Thank you very much.
The vaccines could be a way out of this, isn't it?
Yes, it could be a way out of it. But if we are not able to vaccinate all the people at risk, the situation can continue to occur. And the vaccination, we don't know what government is saying, whether it's going to vaccinate the whole population. Of course, that is not likely to happen, to vaccinate the whole population. And therefore, we should know the areas which are very high at risk to institute this vaccination program. And this should also come along with experts being involved in these vaccination.
Right. So let's try and find answers to some of the questions you have raised already, Dr. Say. We're joined over the telephone again in the conversation by Dr. Emmanuel Jochi. His public health physician, disease surveillance department with the Ghana Health Service. You're equally welcome to the program, Doc. Dr. Jochi.
Hello.
I'm glad you could join us here on News Desk.
Yes, please.
What happened to government's bid to vaccinate people against cholera?
Please come again.
There were intentions from government to vaccinate against cholera. What became of that?
Oh, well, we have expert teams from WHO who came to do an assessment of the current situation of the cholera outbreak. And they realized that there's already extensive spread of the disease, of the cholera outbreak. And many people have been affected. So the use of vaccines may not be effective as there's already an extensive spread of the outbreak. So that's why the vaccination could not come.
But I know usually in cases like that, you identify the high-risk individuals and then give them the vaccines, at least for future purposes. Why didn't it apply in this case?
Yes, that's what I'm saying, that when they did the assessment, they realized that there's widespread of the outbreak. Many people have been affected, so it is very difficult to identify the target group to vaccinate. So vaccination is not the main intervention that you have to use now. We need to focus.
Okay, Dr. Joshi, let me put my question in perspective. We are not looking at now, at least for nothing at all, the cases in Accra is declining, the epicenter for the outbreak is declining, would want to appreciate that fact and then believe that in some time to come, in the very near future, would have a total decline of cholera cases across the country generally. We are looking into the future, projecting into the future. Why?
You are looking at the future.
Absolutely. Why couldn't we identify the high-risk group and then vaccinate those people?
Well, if you look at the control of cholera, vaccination is not the main intervention that we need to focus. We have key interventions that we need to focus. That is a supply of safe water to the people, improved and effective sanitation, that's waste disposal, both liquid and solid waste disposal, and also looking at food hygiene, ensuring that people have access to safe food. It's one of some of the key interventions that we need to put in place. Vaccination can only be used in a very early stage when there's minimal spread to other people. So those are the interventions that we are applying now.
I see. Dr. Jochi, just hold the line for me a bit. Dr. Badu Osei is from the University of Mines, and we were having the conversation just before you joined in. Dr. Osei?
Yes.
What do you think about what Dr. Jochi has been telling us so far about why we couldn't vaccinate even for future purposes?
Okay, let me make a quick correction. I'm from University of Energy and Natural Resources.
Energy and Natural Resources, absolutely.
In the Brown region.
Absolutely.
Yes. Well, vaccination, as he rightly said, is not a key intervention strategy, but it only comes in when the situation gets out of hand. And as per their assessment, he is implying that the situation now is out of hand. And therefore, they would have to go into vaccination. But my point is, whilst you vaccinate, you have to look at the situations which lead to primary infection. Because it is these primary cases which expand into secondary cases for the disease to reach epidemic proportion.
Absolutely. I want us to get into that. But now, let me get clarification on something just before we move on. Dr. Jochi, and so if the numbers or the disease was too widespread and we couldn't vaccinate, why so? Because we didn't have the vaccines.
Hello?
The disease was widespread. Why couldn't we still go ahead with the vaccination?
Oh, I can't hear you.
I'm asking, why you gave us the reason that when the WHO did its assessment here, it said the disease was widespread. We couldn't go ahead with the vaccination. Why not?
Oh, as we already said, you see, when a lot of people have been affected with a disease, so now even targeting who to vaccinate becomes a very big problem when the disease is widely spread to so many people. Because you don't give a vaccine to somebody who has already been infected with a disease. You see, so that's the same thing that is happening now, where there's widespread of the disease and so many people have come down with the disease. So even targeting who to vaccinate is a big
So it is not because the vaccines were not enough?
Oh, no. The vaccines, there are clear ways that you can apply and get the vaccine. But their assessment shows that we cannot use it at this stage when there's widespread of. You see, the current the outbreak has spread to involve almost over a bit over 18,000 people have been, 18,445 persons have been affected with the disease since it started in June. So if you look at this widespread, and 9 out of the 10 regions have been affected. So where do you go and vaccinate? So these are clear.
But Doc, this is a country of 25 million people, and 18,000 was enough to say that there was no need for vaccination.
Come again today.
I'm saying this is a country of a population of about 25 million, and yes, 18,000 infections was enough to say that there was no need for vaccination.
Yeah. Maybe you are not trying to get the understanding. We are saying that see, when there's widespread of the disease, several, as we speak now, about 96 districts have been affected.
Okay.
You understand? So it's really difficult to really say that you are going to take
So what you are saying is that it becomes difficult to protect the rest of the population.
It becomes difficult. No, there are other interventions.
No. In terms of vaccinating, it becomes difficult to protect the rest of the population from the infection.
No, because it will be difficult for you to identify a target group to vaccinate.
I see.
Let's widespread of the disease.
Okay, I prefer we move on to the next issue on the table. Dr. Baduose has indicated that, and I tend to agree with Dr. Baduose, because then a lot of the interventions we have come up with are only secondary, would only tackle secondary infections. How about primary infection? How are we tackling the outbreak at the primary level?
Yes, you know, we already have our interventions that need to target those who have not yet get the infection. You see, when we educate people and provide an enabling environment, provision of safe water, we educate people to drink safe water. We educate people to eat food in a hygienic place, ensure that the food that they eat are hot, are safe to eat, ensuring that they avoid open defecation to prevent contamination of the environment. All these interventions, interventions prevent the primary infection of people.
All these things you have said are true indeed, but I'm not sure that is what we are referring to as the primary infection. Doctor Say?
Yes.
Is it?
No.
Right.
Not
please,
at all.
Take us to what you meant.
Yes. What he is referring to is basically secondary infection. But before I come to that, I want to make another point about why it is difficult to get a target group to vaccinate. I don't know if at their end they have anybody with a spatial epidemiology background. Because in spatial epidemiology, what you do is to look at the spatial spread of the disease. And you can do what we call a cluster analysis or a spatial cluster analysis to select areas which are highly, infectious, okay? And these become the target group. So there are methods, some statistical methods, which are widely available that they can utilize to identify areas of high risk which need vaccination. Now, to come back,
let me have Dr. Jochi react to that briefly. Then we move on to the primary infection.
Okay.
Dr. Jochi, are you there?
Yes, please.
Why couldn't we have that special? What do you call it again, Doctor Say? A spatial study?
Or spatial analysis.
Absolutely. Dr. Jochi, why couldn't we have a spatial analysis so that we can identify target groups, hotspots for cholera outbreak, and then vaccinate in those areas?
You see, Ghana per se, we also exist as a member of the World Health Organization. So that is why we invited experts in this vaccination. So they came in and did a thorough assessment. And their advice was that, as at this stage of this cholera outbreak, we can't use the vaccine. So we should use the already existing interventions that we know about. So that is why we didn't go about it. Because experts have come, they've done assessment, and this they are their recommendations that the stage of spread of the outbreak, we cannot use it. So we didn't take decision on our own. We called on WHO experts who gave us the recommendation not to use it at this stage. Okay,
so then I will ask, are you convinced that there was nothing we could do about vaccination in the country?
Yes, if you look at the epidemiological analysis of the situation, it will not be worth putting vaccination now. We have to go back to our conventional intervention, ensure that we intensify that conventional intervention to keep down this cholera outbreak.
Interesting. Dr. Say?
Yes.
Just a quick reaction to that, then we tackle the primary infection bit.
Yes. I want to make it clear that everything happens somewhere. So the specific locations of the affected people should have been known. The problem that I have seen always is that when there is an outbreak and the people are reported, we don't pick their location, their specific geographic location or their community. Now, this method that I am talking of happens in the 1850s. And it is one of the conventional methods, if you want to put it in that way. John Snow used that method, okay, to identify the cause of cholera in London in the 1850s, which was clear, and they tackled the source, and they were able to find solutions to that. Okay, so that method that I'm talking about, it has been updated, and there are current statistical methods that could be applied to identify the areas of high risk. Of course, I find myself in that field. I'm a special epidemiologist. Okay? Yeah, okay. So I know what I'm talking about. That there are methods that we could identify. But I'm not saying that we should have gone in for vaccination or not.
But based on the reason.
So I cannot conclude. But what I'm saying is that there are methods that we could have used.
Okay. So Dr. Jochi, does that mean that...
Let me try to react to that. You see, we in the department, immediately the outbreak started, we did what we call a case control study to really identify the vehicle of transmission of this outbreak. And we clearly came out and saw that drinking water vendors on the streets, especially the sachet water, were 6 times at risk of getting the cholera. And also those who take food sold on the street by the street vendors, they are almost about 6 times at risk of getting this cholera. So we know, we already have identified the vehicle of transmission of this cholera. So we have collaborated with all the other stakeholders, the agencies, ministries, and we come up with a composite plan.
Okay.
Which,
Dr. Jochi,
implemented,
let me just...
cholera outbreak will be kept down.
I want to understand what you just said about the sale of street vending of sachet water.
Yes.
Did it have to do with the handling of the water or the content of the sachet, which is the water?
Yes, you have to look at it as two aspects. The handling. In the handling, you saw how we transport sachet water. We normally carry it on the vans openly, and we normally put it in the shops, outside the shops. And then we also have street vendors who carry it on their head. They use their bare hands, which may be contaminated. So they pick it and give it to you. And what you do is that you just put it straight into your mouth. You understand me? So the contamination may be happening during the handling. And then also you know that there's a lot of open defecation. So we had floods in April. And this has led to the spread of a lot of infections in the environment. So when you keep the sachet water outside, it's easily contaminated. And also the street vendors use their bare hands to pick it and give it to you. You also put it in your mouth. So that is the area of contamination.
But you see, Dr. Jochi,
yes.
My concern is the fact that in 2013 there were floods. In 2013 there was street vending of sachet water, which we called pure water, but there was no outbreak of cholera. So what was, and there was open defecation, by the way. I didn't add that. What was different about this year? What is so different about this year that the same activities managed to give us 17,000, over 18,000, like you have told us now, cases of cholera? Did your study identify that as well?
Oh, the line is just breaking. As you are speaking, it breaks, and then
so,
I lose the...
Let me go over it again. I was comparing 2014 to 2013, and the fact that these activities you have outlined as the causes of the outbreak of cholera this year across the country generally, they existed in 2013. So what did your study identify as the cause? What was so different about 2014 or 2013 perhaps that there were no cases of cholera?
The network is so bad that as you are speaking, it breaks on the line, and then I lose the the understanding.
You lose the import of the message. Right. We'll come back to that conversation. Just hold on a bit for me. We'll try and fix that problem. Dr. Say?
Yes.
So you heard Dr. Jochi. Your thoughts briefly.
Yes. The last few points that he made are exactly correct. If you look at some of these causes or mediums of pathways for these secondary infections, people sell these sachet water. You realize that when you are buying the sachet water, it is not dry. You see, sometimes even the container that they put the sachet water in has water around it. So when you buy it and you just buy the water and you start drinking, and if the water within the container, which has made the sachet water itself wet, is contaminated, then you are also likely to get infection. So these are actually true pathways and mediums of infection. Another medium which is very difficult to tackle is the provision of safe water. You know, free flow and running water is not constant in pipe water is not constant in Accra. So people tend to store water, and studies have shown that if you store water and different people have contact with the water, that is taking some of the water from the drum or whatever, the water is likely to be contaminated with the bacteria. Most especially when a person in the household has the bacteria, then you are likely to get infection. So these pathways are very clear pathways, which he has said, and they also have to look at these ones.
Okay, so the question I was asking him with reference to 2013 had to do with our mode of handling the outbreak this year. And in fact, outbreaks in the past. We seem to have tackled the mediums and the pathways of transmission without tackling the core of the problem, which is the primary infection.
Yes. I think...
educate us on that briefly.
Yes, I have spoken on your medium before about the primary infection. The disease has been found to be associated with climatic factors, okay? And these climatic factors have some form of temporal characteristics. So the bacteria is also known, okay, to be associated with these factors. And the bacteria's natural habitat is the aquatic river. The sea, for instance, has itself as the habitat of the bacteria. And the bacteria can become virulent based on some of these factors, climatic factors. So we have to have a clear study of how these factors correlate with the disease in Ghana. And I think that is where the missing link is. We have not been able to do that. If we are able to do that, then there could be early warning systems developed to caution people that it is likely to have an outbreak within this period, and therefore we have to be careful.
Okay.
All these warnings that we give about likely outbreaks are based on sanitation conditions in the environment. That if we are able to get an early warning through these environmental factors and climatic factors related to the sea, then we could have a headway rather than always tackling the secondary infection. But the point I'm making is that this requires a government intervention and funding to do these research. Otherwise, we would always stay at class 1.
I'd want us to talk about what it would take for us to do this research. Dr. Jochi, here's where you come in again. How applicable is this knowledge to our fight against cholera as far as the Ghana Health Service is concerned?
No, if you look at all the interventions that need to be put in place, you already mentioned the environment. You see, you already mentioned the water supply. You already mentioned food. Realize that all these aspects of the intervention lies in the domain of other ministries and agencies. You see, so there's a need for multi-sectorial intervention involving all these sectors, which Ghana Health Service has done a lot of advocacy, and we're able to have the interministerial meetings and brought all those other agencies together. Minister of Health, the minister called interministerial meeting. There was a briefing to the parliamentary committee.
Dr. Jochi.
So all those interventions have been put in place. And then also, I want to look at the fact that the primary infection. You see, in the health means, when we say primary infection, we are looking at the individual who got the disease. You understand? And then secondary infection is when the person who got the disease first transmits it to another person through person-to-person transmission. You understand? So in the health domain, when we talk of primary infection, is the person who gets the disease from a contaminated water or food. That is the primary infection as far as health, when we talk about health. You understand?
Dr. Jochi, what doctors say?
Hello.
What doctors say is saying.
Hello.
Dr. Jochi.
Hello.
Hello,
Let me explain this so that you understand it. So to us, if we say primary infection, is the person who has the infection directly when it takes the contaminated water.
That is very clear.
Primary infection. You understand? What he's talking about is the environment. The environment always contains a lot of germs. How do we prevent the germ that is within the environment coming into the human being? That is where we are looking at the vehicle of transmission, the water, the food. You see, how do we break the contamination of our water and food? Because when you break that transmission, we will not get human beings getting there. Though the virus may exist in the environment, we can break that chain from getting through the water or the contaminated food. That's why we are saying that we need to provide safe water to the people. The people should be given safe food.
So the water we
are also very important. As an individual, we should also practice.
Dr. Jochi, one at a time. Dr. Jochi, can you hear me? One at a time. Dr. Osai made mention of the fact that the bacteria naturally lives in the sea.
That is true.
And when it gets into the human body, that is when it is activated.
Yeah.
Okay. And so that is the primary infection indeed, like you have explained. The question is, how well has the Ghana Health Service worked with this knowledge to be able to draw a pattern so that we know that indeed, perhaps this year, this month, we could expect this, instead of waiting for Accra to be filth-ridden before it tells that if we don't check our sanitary conditions, we could face an outbreak of cholera. How can we look forward to a future of a pattern drawn, or drawing a pattern for an outbreak, a possible outbreak of cholera, to protect the Ghanaian populace?
Yes, that's why we are saying that if it comes to the Ministry of Health, Ghana Health, our part that we can play is to, if the people fall sick, we treat them. But the other risk factors lies in the domain in the other ministries and agencies. So what will be done is to have a multi-sectorial collaboration, have all those other ministries come together so that the Ministry of Water Resources.
So did this knowledge come up, and how are you using it? Did this knowledge come up?
Yes. So it's a matter of all the ministries and agencies putting in their intervention, supply of safe water to the people, ensuring that people.
But we don't drink water from the sea. So when you say we should supply safe water to the people, it's like you're telling me that the Ghana Water Company Limited is giving us contaminated water.
No. That's what we are saying. We are saying that the pipe one water that is treated. You know, when this outbreak started in early June, most of the affected communities in the Accra metropolis, they didn't have water flowing in their tap. You understand me? They didn't have the water. You understand? They didn't have the water supply from the Ghana Water Company. There was shortage of water in most of these affected communities. So the idea is that we need to let the ministry water resources provide safe water to the people.
Let me ask a more direct question. When was the last time we had a proper research on cholera outbreak here in this country?
When we did what?
When was the last time we had a research on the trend of cholera outbreak in this country?
The trend.
Yes, of cholera outbreak in this country, a research on that.
Oh, well, we, as a department, we have analyzed all the data as far back as 1983, and we have the trend.
But
we know how it occurs. We know that when the rainy season is coming, it triggers the outbreak. We understand. But we are saying that the risk factors that are contributing to the outbreak need to be tackled.
But that is only a part of that is data collection. That is a part of research. That is data collection. But have we really got down to the field and then research into some of the things Dr. Osei has mentioned right now?
Yes. And then we have also gone down to conduct what we call a case control study, which we did in early June when the outbreak started. That's why we identify the key vehicles of transmission. That's what I was telling you. When you take street-vended water, when you eat street-vended food, you are almost about.
So it was only after the infections were going up that we.
Yes, when there's outbreak,
the Ghana Health Service did a. I see. I now understand what you're saying. Indeed, Dr. Say. Dr. Say.
Yes, I'm on the line.
I'm totally grateful for your patience, but.
Okay.
Your thoughts into the conversation I've been having with Dr. Jochi so far?
Come again, please.
What do you think about what Dr. Jochi has been telling us so far?
Well, what I often see with the Ghana Health Service is they have enormous data. They do lots of data collection. And the case control studies that they did was purposely to target the secondary infections, that is the person-to-person infection. And for data, they have lots of data. But I am looking at a situation whereby we could handle the primary infection. That is giving early warning systems. And that is where we need our scientists in it. Yes, we need people with background in remote sensing. We need people with background in statistics. We need people with background in geographic information system. If we are able to pull all these people together and give them the task to develop an early warning system, all these people would act, collectively together, and we can fight against cholera. Otherwise, it would occur, every 3 to 4 years.
And that's
again
when we become reactive.
Yes.
Dr. Say, that's all time will allow. Thank you very much for your time. Dr. Badu Osei is with the University of Energy and Natural Resources. Dr. Jochi? Dr. Jochi, are you there? I think we have lost Dr. Jochi over the telephone. But that is how far our bid against cholera has come. We couldn't be vaccinated because it was way too widespread in the country to implement any vaccination exercise. And then again, the Ghana Health Service has been collecting data in case study only after the outbreak to check investigate transmission mediums or transmission modes of the disease in Ghana. Well, we hope that we see a better next year as far as cholera is concerned.